You look
That's
marvelous.
tempting.
Marvelous.
So tempting.
All right, we have a special guest joining us this hour. We have Dr. Joshua Redd. He's a chiropractic physician. How are you this morning?
Good. Good. How are you guys?
Yeah,
Fantastic.
It's great to have you.
Good. It's good to be here.
We're
Thank
feeling
you.
a little bit guilty as we sit here with the empty can of Rockstar on the
No, I
counter.
want to hide it.
We know that you are very health oriented. For people meeting you for the first time, tell us a little bit about yourself and your practice.
Okay, so what we do, I actually specialize in what's called functional medicine, and what that is trying to find out the underlying causes to people's chronic endocrine disorders and chronic diseases for that matter. But the main thing that we focus on is low thyroid, and specifically a disease called Hashimoto's disease. And this is where this is an autoimmune disease that will attack the thyroid tissue at a rapid pace and cause a slew of problems throughout the whole body as well. So that's one of the main things we focus on. We see patients from all over the United States and even outside the country right now.
I've never heard of that disease. Is this something that people have? Maybe they don't realize they have it, and it's more prevalent than we think it is?
Without any question. In fact, if you have a low thyroid, think to yourself, what's causing my low thyroid? Okay. Most patients don't think about that. They go to the doctor. The doctor will run a simple TSH marker, and they'll see that they have a low thyroid and give them a thyroid hormone, and that's it.
So they treat the symptoms, but they don't go to the cause.
Exactly.
Okay.
And the patient's not asking themselves, well, what's causing my low thyroid? So if you have a low thyroid, ask your doctor, what's causing my low thyroid?
Okay.
And the number one cause is an autoimmune disease that is attacking the thyroid tissue. And this is a disease called Hashimoto's. So their body's basically turning on itself and destroying the thyroid tissue at a rapid pace, but it's also causing what's called inflammation, kind of like swelling, but inflammation throughout the whole body, and that causes a slew of other imbalances elsewhere, and they feel little to no improvement and just keep getting worse and worse and worse and have more symptoms and more symptoms.
What are the symptoms? Like if you have low thyroid and you just don't know it, what would you be feeling right now?
So you'll be thinking the fatigue, depression, headaches, anxiety, restlessness, insomnia, inability to lose weight. We'll have patients that can barely get up out of the bed in the morning. We'll have patients that can exercise till they drop dead and eat a 500-calorie diet, and they'll still gain weight. So, I mean, it can be a vicious cycle. And a lot of these patients end up just being hopeless because they're going to all these doctors and nothing's being done to the mechanism of their disease, so they still feel worse and worse and worse.
Right.
It's a very frustrating thing.
I think a lot of people, you think fatigue, and I think, okay, I have this job. I get up at the crack of dawn. I have kids. I mean, it's crazy that the lives that we lead now and how jumbled and busy they are. So how do you know if it's just you're tired because of your life or it's fatigue? I mean, what's the difference, do you think? I mean, how would you start to recognize kind of you have a problem?
When you're seeing that you're consistently fatigued over a prolonged period of time, that's when you should realize I got a problem. This isn't just because my lifestyle or because what I'm doing. If you're consistently fatigued, you definitely will have a problem.
Okay.
And you should get that checked out. And there can be lots of things that cause fatigue, but instead of just guessing, it's important to do the best test that you can to pinpoint and actually figure out what's causing that issue rather than just treating the symptoms.
Okay. Because a lot of people will try and lose weight and they'll join gyms and they'll buy books and they'll buy pills and everything else. And so this would probably be great if you just go in, get a blood test, and figure out that this is not the problem.
Without
right?
any question,
because
yep.
Otherwise, you're spending a lot of time trying to correct a problem that you might not be able to correct.
If you can go to someone that specializes in blood chemistry, they'll be able to do a blood test, know what test to run. They'll take a quick history and then know what test to run and be able to pinpoint exactly what's causing it, and they can work with you to get things functioning better. But I think it's really important. If you're seeing these symptoms on a consistent basis, you should definitely get it checked out.
I thought your title was interesting. You're a chiropractic
physician.
Yep. So when I think chiropractor, I think you're going to go crack me back into place. So
after chiropractic school, chiropractors, our schooling rivals medical doctors. So we have all the, we have just as much credits and we're in class just as much as most medical schools are. And we learn about all the pathology and physiology and all that, anatomy and all that stuff as well. But then after school, we went on and I was board certified in what's called functional medicine. And that is where we received a lot of our training for looking to find the underlying causes to these chronic disorders, and specializing in blood chemistry and things like that. So, yeah, we try to take a natural approach as well, but instead of just guessing and doing stuff based off guesswork and theories, and sometimes you can see these doctors doing some weird stuff that, that's kind of hokey pokey.
Yeah.
I mean, we don't do that. I mean, everything that we're doing is based off of 20 years worth of research and literature and some of the top medical journals, but instead of giving medications that will block, inhibit, and downregulate function to whatever they're giving it, whatever symptoms it is for. We do a natural approach where it's designed to upregulate, enhance, and restore function to that particular problem, and it doesn't cause any severe side effects. But the most important thing is everything that we use as far as a clinical nutritional supplement and things like that, we'll be able to see the measurable differences in the blood work, and obviously the patient's able to improve and feel a lot better as well. So we're not just, you go to the medical doctor, they might do a basic test and give you a pill for your symptom, or you might go to an alternative doctor and they do this like weird hokey pokey stuff and still guess and give you supplements for your symptoms, and then everyone's guessing. And then the patient is the one that is frustrated and leaves confused and has no idea what's going on with them. We try to take a very evidence approach and it's
a lot more detailed. It's actually probably just to you and your lifestyle and your problems and figuring out your solution.
Yep.
Okay. I like that.
Yeah. Instead of hurting these people around like sheep and treating them like a protocol, you as an individual might be totally different than the next individual. And even these patients with Hashimoto's or any type of chronic disease, they might have different imbalances that are associated with their disease rather than the next patient. So you have to really customize a very personalized treatment plan to get the best possible outcome there.
I was going to ask you about this too. Adrenal, is it burnout? What is that?
Adrenal fatigue is probably one of the most common conditions in America right now. You think about all of our lives. America now, we have these high-stress lives. We're on demand all the time. We're constantly looking at emails, and everyone can get a hold of us. We're on a go, go, go type mode. So what happens is the adrenal glands are the stress gland, and these glands pump full steam ahead when we're stressed out, either emotionally stressed, physiologically stressed, hormonally stressed, things like that. These adrenals will be pumping full steam ahead. And over time, these adrenal glands can't function like they should, and when that occurs, that will end up causing a lot of different problems. One of the hormones is called cortisol that the adrenal glands will produce. Cortisol will actually become really unrhythmic and cause a slew of different problems. And this is one of the reasons why now you see these, people walking around that are living these high-stress lives end up having these severe chronic diseases. This is one of the big causes of why diabetes is on the rise and autoimmune diseases are on the rise as well. High cortisol does a lot of different things. High cortisol will cause insulin resistance, which will end up causing what's called inflammatory cytokines to increase throughout the whole body, which ends up causing more insulin resistance.
So it's a domino effect. This is sort of getting in while it's starting, and then you realize, hey, I'm not feeling quite right. I'm not myself, and so you get in at the very beginning, right?
Yeah, because you think about it, one little imbalance can set this domino effect, and all of a sudden lead to some serious complications. And so, it starts these vicious cycles in your body, and they just keep getting worse and worse and worse, and the patient keeps getting worse and worse and worse. But you really have to go in and do the best test that you can to figure out and pinpoint what's causing that issue. Oh. And so if you're really feeling this way, if you're chronically fatigued and you live this high-stress life, you got to take a step back and reevaluate what in the world is going on with my body right now.
Right, because your body, you are going to suffer for it in some way, right? And so you can't live like that 24/7 every day. I know I'm stressed. My friends are stressed. Everybody's living these just incredibly stressed lives, and something's got to give.
And you think about this, the adrenal glands are a huge gland to help regulate blood sugar levels. And so what happens is these patients will have really unrhythmic blood sugar levels after that. Then they end up leading to type 2 diabetes or metabolic syndrome, which will cause a significant inability to lose weight and things like that as well. It can lead to a lot of different problems. So it's important.
My word. I know we're definitely going to post where to go and get some help for this, too, on our website, too, so people can find you. Because, I think more people suffer from this than you realize.
Yeah.
And I think we're so quick to blame it on stress, but when you start to realize how long you've been living that way or with these symptoms, and you've just sort of accepted them, because I know with me, I just sort of accept that I'm tired all the time. I just sort of accept that I don't feel good, and you're thinking, wait a second here, something's going to give, and I don't want it to be ending up with something I can't.
That's not normal. We'll have patients come to our office and they have a slew of symptoms and they think that it's normal. They think it's because they're a mom of 5. And once we get down to it, we start realizing, hey, there's a lot of things that we can do. There's a lot of basic strategies that we can do to really help these patients improve and have a lot better quality of life.
Right. And
that's a good point, too, because you think about it, a lot of these patients have to take an active role in their health as well. We're basically as good as they are, because if they don't do what we ask them to do, we fail and we have problems, especially with Hashimoto's and adrenal gland dysfunction and all these different little imbalances that you're talking about. You can't cure it. So you can manage it and you can tame it immensely, but you can't cure it. So
and you can manage it so it doesn't turn into something else. Everybody goes in when they're practically on death's door to a doctor, which is kind of ridiculous. And I'm guilty of it too. So I'm calling myself out too, because I'm the last person to make the appointment because A, I don't have time, or B, I just feel like, I don't want to accept that something could be up, and I don't want to have to spend the time to even think about managing it. But you know what? It's probably more simple than I think.
It really is.
Okay.
And the big part that we like to do is we like to teach and educate these patients and show them what to do and what not to do, so that before they're confused and frustrated and they don't know why they felt the way that they feel, but then afterwards they're empowered and they have control of their disease or their condition, and they know exactly what to do and what not to do to keep it in check. A lot of these patients, they're in a very deep rut and they can't get out of it. Our whole goal is to help them get out of the rut and then teach them to stay out of the rut. And so we're empowering these patients and teaching them this so they're the expert in their own health. But because of that, though, they have to take an active role in their health to get the results that they want.
Okay, let's give people the information. Where can they go? Where can they go to get more on this?
Yeah, you can go to our website at lowthyroid101.com, and there's brochures that you can download. There's testimonial videos on there, and you can go on there and check it out, read the brochures, and see what you think. And we also offer free consultations as well for patients who have questions like yourself.
Right.
That just want to say, hey, what's going on with me? We can do an extensive blood test. Yeah, if you feel different, we can do an extensive blood test and pinpoint what's going on there, and it's free. So unless we know we can help you, we don't charge you anything.
Well, it's like, aren't you better off doing that like this week or next week than waiting for something catastrophic to happen to your body? It's like we all play this chicken game, don't we, with our health a little bit? It's like, oh yeah, I'll wait until it's really bad. It's like
it's very true, and then it ends up leading to severe complications, and then all of a sudden we were close to having a stroke and heart attack and a slew of issues. These are things that we can just decrease tenfold if you take the right steps and go that route.
Well, there's just no reason not to want to feel good right now. You should want to feel good.
You should.
Yeah.
It's a good time.
Yeah.
Life's great.
I know. So I agree with you. I'm actually excited to go in and do something because I feel tired. I'm fatigued.
Come in. Come in. Stop being fatigued. And do something about it. Come in. We'll do a blood test and we'll get you taken care of. At
least rule stuff out. So and then doesn't that alleviate stress?
Oh, for me it does. When she's not tired and fatigued, I'm much better off. Come on. You threw me the softball pitch and then you expected me not to swing.
Mean.
Please.
Anyway,
I'm staying out of this.
Yeah, I would if I were you. Anyway, but yeah, I so appreciate you coming because that does. It gives you sort of a check. Like, you know what? Get in there and do something about yourself because we're always the last to care for ourselves. We just wait. Like I said, we play chicken and we wait for the bus to hit us. It's like, come on.
Well, especially moms. I'm telling you, especially moms. Not to go away from the dads, but these moms, they have a lot that's going on there, and it's not just them that's affecting their health. If their health's bad, they're affecting their husbands, their families, their children's. I mean, it's an awful mess. We had a patient who came in, and her son was asked to draw a picture of the family at school. Mm-hmm. He drew a picture of the family and left his mom out and put her on the side on the bed because that's how he knew his mom.
No.
And so
that breaks my
a lot of our patients, I don't think they realize, it's not just their health and the effects that's really going on to the family. So it's affecting their whole life. I mean, these patients are hopeless, and it just makes me sick sometimes to see how long they've lived this way. And there's lots of things that we can do to help them. So
it reminds me of the old jokes. Moms aren't allowed to be sick.
They're not,
because they have to take care of everybody else. We're not allowed to have a sick day.
No. My wife cannot get sick because she does. I mean, holy smokes.
Right?
Yeah. When she's sick, I'm lost.
The world stops spinning on its axis.
And I start realizing how hard life is. Doing the laundry.
The momager does
taking care of the 3 kids. I know. It's awful. I can't do it.
That's so true. Oh, my gosh.
All right. Dr. Joshua Red, thank you so much for coming in this morning.
Hey, thanks for having us. Thanks for having us. Appreciate it.
RedRiver. All right. Thank you.
Okay, got to say a word about Daily Bread emergency food supplies as we go to break.